Hello and welcome to this short tutorial on how to use Cascade products. By the end of this tutorial, I hope that you'll have a better understanding on when to use Cascade products, the different types of Cascade products, the governing regulations, how to apply for a special import certificate, and purchasing, storing, and administering of a Cascade product. Now, I know this is a fairly dry area to give a tutorial on, but I think it's really important to understand how to do this because in our experience here in Nupsala, it's something that we run up against quite a lot. Either a practice doesn't know how to apply for the SIC, the Special Import Certificate. They're not sure whether a product can be used, if it's a human, or if there's a UK licensed veterinary medicinal product first. So let's look at what you've got to do first and foremost, and that is where there is a UK licensed medicinal product, you have to use it. There is no grey area. There's no, well, there's a cheaper one abroad, or perhaps there's a different packaging which is appropriate for me. I've certainly seen this where a UK medicinal product is in a 50 ml bottle, but over in mainland Europe, it comes in 10 ml vials. If the UK one has its license, as much as that's an inconvenience for you, you have to use that licensed product. You don't have the decision to go outside of that yourself and purchase what you want because it's convenient to you. I think everybody knows that, but really you've got to understand there is no grey area. Okay, so where we've got a situation that comes about where there is no alternative suitable veterinary medicinal product, we then can seek to use a product which is either a medicinal product registered for veterinary outside of the UK or a human licensed product, or in certain circumstances, a non-registered medicinal product. So if we look at the types of Cascade products or where you enter the Cascade, really the first thing is where we start to use the off-label. So we've got a UK licensed product that is possibly safe for canine use, and it's a registered UK medicinal product for canine use. And then we have a situation where, as an equine clinician, you can use that product. And there are a number of products in that category. I'm not going to be picking products out because I'm not going to be marketing products like that in this tutorial. I just want to demonstrate that really the first line of a Cascade product where you're using that alternate use, so you're coming off label for the use of that product, it still needs to be handled. So we really do need to inform the owner, which is the first thing we should be doing, that you're using potentially a dog licensed or a small animal licensed UK medicinal product on a species which is not licensed. So the owner needs to consent to you doing that. The documentation that goes with all use of medicinal products, it needs to be obviously registered in the patient's data, in its clinical records, and followed up just to make sure that there is no adverse reactions. Your dose rate is a really important one because really you're really appealing to, I would say the first and foremost is go back to the manufacturer and ask them how to use the product off label. They're probably the best source for dose rates and how to use it and what the contraindications may be. I know a lot of us actually look to other colleagues or other practices as far as that advice, but what I would say is always try and gain that advice first and foremost through that chain of information back to the manufacturer. The next one that's going to happen is the importation of a veterinary medicinal product from outside the UK or human licensed products. And really what we've got here is that the UK outside one really should be used first. Why? Because it's already been trialed, it's been registered in another country, say France or Germany, for that species. And if we have that, at least we know that studies have been conducted, we know that dose rates have been determined, contraindications have been laid out for that particular product in a veterinary licensed channel. When we're bringing products in from the outside of the UK, this is where we need to start the process of applying for an SIC, your Special Import Certificate. And I'll come on to that in the next few slides. The next one, like I said, is, and it kind of goes side by side, is the use of a UK licensed human medicinal product. Now, the human licensed medicinal product would obviously fall into a category where there is no veterinary licensed versions of that. And if it's a UK licensed product, providing you're getting it from a wholesaler who is licensed to sell you human medicinal products, then that is all that is required. Now, what happens here is that the product comes through into the veterinary market at the point, and this is a human medicinal product, at the point it leaves the registered wholesaler that is permitted to sell you human products, it will be declassified. Now, this is an important aspect because when you purchase a human medicinal product from a UK wholesaler, because that's the channel you've got to use, is that when it becomes declassified, it means it can't go back. It can't go back into the chain. And that's one of the criteria of supplying human products into the animal health market, is it's declassified, and that's to stop it going back up the chain and back into the human chain, the human logistic chain. So one of the criteria is that you'll find that when you are purchasing a human medicinal product from a wholesaler is there won't be any ability to return the product. So do bear that in mind when you're ordering the product, the volume that you're going to store. The next one will be in a human licensed medicinal product from outside of the UK that you're going to import. So again, you've already searched, you've ascertained that there is no human licensed equivalent product. There is obviously no veterinary licensed product in or outside the UK. You're then broadening your search to look for a registered licensed human medicinal product from outside of the UK. Situation also applies with this product, the same as the veterinary products from outside the UK. You're going to need a special import certificate. Both of those, like I said, I'm going to come on to the next few slides, and that's obtained through the VMD website. And again, under exceptional circumstances, and they can look at this as an unlicensed medicinal product, or where a product hasn't got a classification. And this is really on a case-by-case basis that the authorities would look at how this product is used. Now, all of these products, if we think about how they're used and the paperwork that goes with it, is it's really to safeguard the patient. It's to understand how these products are being used, the formulation, the manufacturing capability, all of this track and traceability, so that if there is ever an adverse reaction, there is a paper trail all the way back so that we can figure out what went wrong. We can take the necessary action, prevent it happening again. So I'm going to put a bit of a plea out here, is that we know that there are products available to practices. We really should be adhering to the rules and regulations. We get a lot of pressure, especially in the equine industry, to use products that are outside of the UK. There is a method to bring them into the UK. Do not try and bring products in from outside the UK, because that is not permitted. There is a pathway to do this legally. And what we'll do is we'll work with you. And here in Nupsala, if you've got a situation where you want to use a product, you've gone through that kind of the cascade decision, you know that it's not available in the UK, it may not be available in Europe, it may be outside of Europe, is tell us your case, tell us why you want to use it, and we'll work with you to help approach the authorities, the VMD, about how we might be able to get that product in and supplied to you. So the governing regulations, if you're unfamiliar with the governing regulations, and anybody involved in the practice who is responsible, say the pharmacy manager, practice manager, a nurse technician, or even if you're a single practicing vet, is do get familiar with the governing regulations. Why? Because it's law, and we cannot use ignorance as protection. And you, the clinician who's treating, sorry, so any clinician who is administering a product, these regulations apply to you. So whenever you administer that product, it's got to be compliant. And ignorance is no defense. So if you're using a product, you've got to know that it's a licensed product, or it's covered by an import certificate or a treatment certificate, and that everything is done in accordance with these regulations. And specifically about the use of veterinary regulations is, if you haven't actually done it yet, get a hold of a copy of the veterinary medicines regulations. You can find it here, both of these web links. I think we'll be making these live, or at least if you copy them down word for word, letter for letter, you would be able to go through to the necessary areas on these government websites and print out or save these regulations. And I do urge again that you read and get familiar with them, because everything you need to do is there. Okay, so the next thing I'm going to take you through, and this is an area which some people have never done before, and it's a little bit of a self-tutorial on how to use the VMD website to gain an SIC for the use of a veterinary medicinal product outside of the UK, or a human licensed product outside the UK. So these are products which you are effectively importing to use in the UK. And just to reiterate, these are for products which are not a UK licensed veterinary medicinal product or a UK human licensed medicinal product. So you've gone through both of those, and your option now is to seek a veterinary or a human licensed product from outside the UK. So if you go onto the VMD website, this is it here. I normally find a really quick way to do this. If you do SIC space VMD on Google, it'll take you straight to it. And what you're going to get is you're going to get this home page. So as a clinician, as a vet, that's actually going to fill this out. And I do stress, by the way, everybody, this is a application by you, the vet, the treating vet. Okay, I know the temptation is for other people in the practice to fill this out or to approach it, but it is your application. Okay, so it's important that the information, the process, and everything that's done on this is done in accordance with the regulation. Is there actually a registration for a product by you, okay, the vet? Okay, so what you're going to do here is, this is it here. I am a vet, and I am a veterinary surgeon who wants to import a product from outside of the UK for veterinary use. This here, if you were a wholesale or something else, then you'd be ticking here, and then click on to next. So that's the first bit you're going to go to. Right. The first stumbling block I normally find most people is they'll put in their RCVS number and they don't get anything. So what will happen is when you click next, you'll get a drop down menu to pick where your practice is registered. Now, everyone thinks that the RCVS number and the VMD link. They don't. You need to be registered with the VMD. You need to have a prior history with the VMD. It's not automatic. So again, this is important because if you're trying to do an SIC for a patient and you want to be using a product, you want to order it today for delivery tomorrow because you've got a procedure lined up tomorrow, and you go through this, it's not instant. So by the time you put your RCVS number here and click next, if it's not, there is a place that you can actually go to register, and it'll take a day or two to obtain that registration. And until the VMD actually recognize who you are, you will not be able to go through this. Now, the next thing that will happen, in fact, sorry, I'm going to go back. Obviously, this is a dummy. I haven't put anybody's RCVS number in here because that's not what I should be doing. I'm just demonstrating this to you, is that when you put it in and you click next, what's going to happen is it's going to give the address that the VMD have you registered at. Again, it's important that you keep this updated. All too often, we'll find vets that will have the registration and it's linked to their previous employment. So make sure that you periodically go through this, check on the VMD website. You can actually check on by looking into these couple of screens if the VMD know who you are and it's registered to the right place. You don't necessarily need to go through to a registration process or try and get an SIC to check that. You just do these first few screens, just make sure that's all up to date. Or practice administrators, practice managers, pharmacy managers, make sure that when a vet does join the practice, you at least have a look to see if the VMD know who they are. It's important because this whole certificate is going to be linked to that clinician and linked to the address that the VMD know where you are. And if they've got the wrong address, then really this certificate is nil and void. So don't just go clicking on your previous address that you were there before, don't worry, it'll all catch up. No, because that's false. Okay, and this needs to ensure that all information is accurate. So if you knowingly and willingly click on your old address just to get it through because you need an SIC, that's fraudulent. Okay, so just be really careful. So again, just make sure that you've got the right address linked to here. So you're going to go through, and the next thing it will do, once it's actually picked up who you are, is you're now looking at the actual product itself. Now the VMD have gone through a process where they will look at a product and they will allow it to be imported. If it's permitted to be imported, there is quite an extensive list. It's alphabetized here. So you're going to scroll through looking at the product that may be available. So you already know the product in mind. What you're going to do is you're going to scroll down and find that product. If it is not that product, you're then going to have to apply. Now the area that you would apply is here. So the first thing you're going to do is scroll down, find that product, and go through the process. And I'll go through that in a minute. If it's not there, you've got to go here. And that's a completely different tutorial because what we're looking at here is it's a individual application to look at a product that you want to use on a patient. And it'll go through a whole list of questions about where the product comes from, how you want to use it. And then that will go through to the VMD for processing and they will make a decision. So it is not a straightforward process. It does take time. It's not guaranteed that you're going to get permission. What I would do is, if you are going to go to here, before you even go there, is obviously if the product isn't in this list and you're going to go into this area here, is you're going to need the manufacturer. Okay, you're going to need help from the manufacturer, because there's an awful lot of information you need from the manufacturer. And typically that information is how the product is manufactured, what the ingredients are in that product, where it is manufactured, who releases that product, the qualifications for the person who releases that product. You can kind of get an idea what the VMD are trying to do already, is that they want to look for good quality, robust, reproducible manufacturing that complies with their levels of quality, to ensure that when it arrives in the UK, they know exactly what it is and how you intend on using it, and that there isn't a near product or an equivalent product that they know of that you should be using anyway. Again, none of this should be driven by convenience or price or your own thoughts about it, is that there is due process to go through. So again, it's not an area I'm going to cover. If anybody's got a problem with this, give us a call in the office. We're pretty good at guiding people through it. We've certainly got a number of products through and listed with the VMD by doing all that work. And it does on average take us 2-3 weeks even just to get it to a stage. I think some of the times it's taken us even a few months. So again, don't start talking or thinking about using a product on a case that isn't in this list for the fact that it's not a fast process. Okay, so we've gone through, we've found our product, and now what we're looking at is what's going to happen is it's going to split into two ways, depending on the product, okay? And I've picked out and highlighted a product here, and what we're going to look at here is that this particular product, when we're looking at the SIC, is for the individual patient, okay? Now, when it's for individual patient, it's not for stock use. You're not stocking the product. You're not buying in volume. You're getting an SIC to use that product on that individual patient. So you've already highlighted from the drop-down menu that you've got that product. You're now going to click the species that you're going to use it on, and that means it's already being classified use for this by the VMD, and then we're going to click next. The alternative to that is products that say, and very much these are veterinary licensed medicinal products, say from outside the UK, say like a French medicinal product. And what would happen here is you can see the difference between the two screens is that this has already been classified, and what you've got here is your own reference, if you need to, is the number of animals and the volume. Now that's important because you've got to figure out your average volume that you're going to be using. And normally that's in mils and not in bottles. Don't get caught out by that one. And the number of animals that you're going to be treating. Now an SIC, both of these certificates last for a year. They're 12 months long. So there's no rush to use it. What you're looking at is on the individual one, how much does that patient need of that particular product over the next 12 months? So am I going to need to medicate this, this patient in 6 months' time? Okay, so I need 2 times the dose in 12 months. And again, whatever I'm going to be using on my collective number of animals that I'm going to be treating, and the volume that they're going to be using, say in milliliters or in weight, whatever this comes up with, and that's what you've got to try and calculate. And don't be caught out by ordering too much or too little. Try to make a good estimate on your use. Now, what's important here is that your SIC takes you up to that amount. Your wholesaler and your practice will hold that amount, and really it's an amount which you don't have to order at once. So don't think that I've gone and got 1,000 mils permitted here, I need to go and order 1,000 mils. No, it's up to that amount. So you can order 100 and then you might not need another 100 the following month. These are mils. So what will happen is it's almost like a volume which is decreasing. And when you run out, you will then need to apply for another SIC, okay? But do make a note, diary note, or the anniversary of each SIC so you know when it comes around. Because what's important when we get to it is that any product you have, if it's an individual's product or if it's a group one, such as the one on the right here, is that when those SICs run out, you need to put an SIC in place to cover what product you've got. So for instance, if you've still got 100 mils on the shelf and the anniversary of the SIC comes up, you need to apply for an SIC at least for the 100 mils you've got on the shelf so that it corresponds with what paperwork you need. So again, it's another diary point to make sure that those SICs are in place. And if it's the individual one, if you haven't used all that treatment in the 12 months, but you think you may need to do it again, say a month or two after the anniversary of that treatment, you're going to have to apply for an SIC again for what you're holding for that patient. It's for the actual product and the time. Again, a lot of practices get caught out by that. They think, well, I had that on the shelf. I got my SIC about 14 months ago, but I haven't used it all. As soon as it runs out, then you need to get that SIC in place to cover it. Okay, on the individual one, I'm going back to that now, is that this is where you need to have important information, is that we're going to go back and the SIC is attached to the owner's details. So you're going to have the patient's details and you're going to have the owner's details. So you need the owner's name and address, and that needs to be a UK address. And this gets quite interesting when we start looking at addresses in Ireland, where obviously when it gets close to the border, is that this is specifically for the United Kingdom. So if you are a Northern Ireland vet that you're doing a little bit of work in the south, or you've got clients who very close to the border probably live the other side, or horses travel backwards and forwards, is that this is specifically for the UK. So the UK address has got to be a UK address that's linked to a UK practicing vet. And on this, you're going to go through the details and what you're going to be using it for, the dosing and any other information. And what we put in here is how you're going to use the product. So there is a record of that. And who your importer is going to be. So you've got two decisions here. You can either, as a practice, you can import it yourself. You are permitted to do that. You are the importer. Or you can go through a wholesaler who has the product that they've already imported. What's important here is that you are bringing it in and you are wholly responsible for its import, and it comes via the manufacturer on there. So what we're saying here is, if it's a product which is a registered product in the States, it's got to come from the manufacturer. If you are going to be importing it, you are responsible for importing it. And I would urge you to get it from the manufacturer. That way you know that it's not been tampered with, it could not be a fraudulent product, it hasn't gone through several hands, and really it's a more robust way of ensuring that you get the product which you are responsible for importing. Or like I said, you'd go through, and typically here this would be where you would put someone like Nupsala as your importing wholesaler and click onto the next screen. The declaration. Okay, this is a declaration by you, and what you would be doing is clicking to say that you understand the cascade. So it goes back to my first few slides. Have you read the actual notes about using cascade products? You can't go clicking here if you're not familiar with that. Otherwise, it's a fraudulent declaration. Are you familiar with the veterinary medicines regulations and how to store all information in accordance with the legislation? Again, if you haven't read it, go back and read it, because you can't click that until you've done it. I really urge you to understand this, the gravity of this declaration, to make sure that you're compliant with law. Okay, so when we actually go through and click all of these, you are then saying that it is what it is, and then you would click into next. Now, the important thing here is this email address. Why? Because the certificate is going to get emailed to you. And if that email address is wrong, you're going to disappear and you're going to lose that. All right. So again, just make sure that that email address you've got access to, or it could have been a practice email address from a previous registration. It hasn't been updated. So just make sure that that is what it should be. And what that will then do is give you that SIC. And what you're going to do is you're going to hold it for the period of time. It should be either downloaded onto the clinical notes of the patient, or you should hold it in the practice for the predetermined time that the VMD and the veterinary medicine regulations inform you to do so. So that was a very quick tutorial, and hopefully you understand when to use the cascade products, how to use them, the governing regulations, where to read up on those governing regulations, how to apply for an SIC, and then the storing and administrating of the cascade product itself. If you've got any other questions or queries or problems associated with importing a product, or even if it's something that you think you might want to use, give us a call here in the office on the number down below, or email us, and we will have a chat with you about whether or not we think it is a product that can be licensed or can be imported. we may know if it is imported already, or we can certainly help the practice through the necessary application process. Okay, hopefully you found that useful. Good to get some feedback if you did find that useful, and always here to help if possible. Thanks a lot.